Perimenopause. So hot flashes, the classic symptom, irritability, sleep disturbance, excessive bleeding, so fluctuations in frequency of menses, weight gain, loss of libido, vaginal dryness. So the average age of menopause in the United States is 52, and the definition of menopause is having no menses for 1 year. By the way, just as an aside, there's starting to be studies on NAD actually prolonging menopause. This is mostly in animals, but very interesting stuff coming out, and whether that's something that women want or not is debatable, but certainly it's interesting to think about why that would prolong ovarian production long term. And we just don't know, but it's an area of research that's ongoing. So what happens with hormone fluctuations during menopause? So during premenopausal years, we see a pretty consistent cyclic pattern with women. It goes up and down and up and down. And then perimenopause, I usually say it's like this, right? And women feel that. They feel like this. And the lucky ones, they feel like this. But it can be really, really challenging to get through this time of life, which most women are still raising their children at that point, or their children are in their teenage years, which can be challenging by itself. They're probably working, and they're trying to balance, their own semblance of self. So when you add these fluctuations of hormones, it can be a really tough time. And if you're not thinking in terms of how can I address the whole woman, not just her hormones, you're missing out, right? You're missing for her. She's missing out. So you have to think about this. But from a hormonal perspective, we really want to address how can we help support regulation of those hormones to the best of our ability. So here are some labs to consider. A lot of these should be redundant from what we talked about earlier. Again, serum labs are covered under insurance, generally speaking. It does give you a snapshot. Urine testing can give you a little bit more information to understand how estrogen is processed. FSH, LH, estradiol, pregnenolone, DHEAS, sex hormone binding globulin, testosterone total. I put an asterisk next to progesterone. That's because we know that progesterone in women just has a much more slower gradual decline, as opposed to estrogen fluctuations are like this. So if you're testing a woman who hasn't had a cycle in 6 months, 8 months, her progesterone is probably going to be low. And if you're thinking about doing some sort of hormone replacement anyways, I don't always find value in testing progesterone for that reason, but certainly you can add it if it's something you want to look at. Progesterone, as a reminder, surges post-ovulation. So if she is kind of in the early stages, or you have no idea if she's actually in menopause yet, you could think about looking at a day 21 progesterone, meaning if she's ovulating still in the middle of the month, progesterone should be highest around that day 21 if it's that classic textbook ovulatory function, and that will tell you anything above 3 for progesterone on a serum lab is pretty indicative of consistent ovulation. Lifestyle approaches to menopause management. So what do we do? So 100% of my menopausal patients, they get a detox food plan. And detox food plan, what does that mean? Tons of leafy greens, crucifers, flaxseed, chia seeds, just going heavy on fibers, trying to stay away from a lot of the inflammatory foods, gluten, dairy, just really going heavy on the veggies so we can help support liver processing. And we'll talk about the liver in our next slide. Increase fiber, so I just said that. Reduce or eliminate alcohol. You tell a perimenopausal woman to take away her alcohol, she's going to look at you like you have 5 heads if that's a part of her life. So it's a conversation about symptom management. And when she's having 10 hot flashes a day, and maybe she's not ready to consider hormone replacement, you're not ready to consider hormone replacement, alcohol reduction or elimination can be a huge opportunity to completely, not completely, but often reduce some of those. And there are lots of these botanical alternatives to wine these days that are actually adaptogen botanicals. And so they look like a bottle of wine. So I'm encouraging some of my patients, still have your ritual with your husband or your friends, but try to really reduce the actual alcohol intake. It can make a big difference. Exercise routinely, right? So one of the things we know is that can also stimulate all the anti-aging mechanisms we've already talked about. Also can play a big role in processing hormones. Balance the adrenals. If her adrenals are fried and you're now introducing more hormones, you're gonna see some challenges there. So adrenals are important. Meditation practice. I tell my patients I want you to fall in love with meditation. So there are hundreds of these meditation apps out there. There are so many options to get into meditation, and if they're having sleep disturbance, if they're having irritability, if you can get your patients to meditate, do it, right? And the best way you can get your patients to meditate is do it yourself, honestly, and then you can be like, hey, it really works. It's a real thing. Sleep is essential. Reduce caffeine. Balance blood sugar and avoid toxins. So cosmetic products and personal care products are one of the worst sources, particularly for women. Shout out to the Environmental Working Group. They have a website called Skin Deep. It's a nonprofit, and you can type in your personal care product or your cosmetic, and that will tell you the level of toxicity that it has. And then you may want to choose products, or you do want to choose products that are going to be less toxic. So EWG Working Group. It's called Skin Deep. I send a lot of my patients there. So what botanicals do I think about in regards to managing menopause? So black cohosh, it definitely works. It's a great product. Hops is another one. Rhubarb, I'll talk about that as part of my menopausal protocol that I use with patients. Soy, organic sources of soy, so phytoestrogens. Red clover, and anxiolytic herbs. So if their anxiety is sky high and you're not addressing that, even if we get the hot flashes lower, anxiety alone can cause a hot flash. So just know that balancing all of that is important. So what do I do for my botanical approach? So I already mentioned 100% detox food plan. They come in, they're getting a detox food plan if they're perimenopausal. Siberian rhubarb preparation. So this is made by Metagenics, which I do have an affiliation with, so full disclosure, but I think it really works. It's called Estrovera. I dose it as once a day to twice a day. I also add in black cohosh, okay, and that's pretty widely available. A lot of great nutraceutical companies. I do 250 milligrams twice a day. And I do use the lavender oil extract studied under the name Selexin, sold as Lavella from Integrated Therapeutics, and they recommend 1 capsule at night. I see 2 capsules work better, so I do get really excited about this one. It's been compared head-to-head with citalopram as well as against Xanax in a small study, and it's performed really well. I do see it work in my practice. I like to see it in combination. I don't rarely use it alone.